And thank you, Sarah, and thanks to Mia, and congratulations both, and to all the researchers in Kenya on a fantastic piece of research and a great report on something that I think hasn't been discussed enough. I just want to talk a little bit about IRC, International Rescue Committee's work in Kenya generally, and particularly our work with urban refugees and some of the challenges that we've faced in trying to assist them. We've been there for 18 years now, and we have been providing services in refugee camp settings, like many humanitarian organisations. We work both in Kakuma refugee camp, which was set up for the Sudanese lost boys in 1992, and now has more than 50,000 refugees. And there we provide healthcare, sanitation. We run education programs to prepare people for repatriation to Sudan. We have a comprehensive HIV and AIDS awareness program that works both with refugees and the host population. And we also work in one of the large camps in Dadaab, in Hagedera camp, which has about 100,000 mainly Somali refugees. Again, there we run what you would expect to see in refugee camps. We have health clinics that work with the populations in the camps. We also have sort of community health workers that go out into the community, again, within the camp setting, and particularly provide nutrition services and HIV and AIDS services. That's almost sort of standard programs for humanitarian organisations who work with refugees. You can see that replicated really in refugee camps all over the world. And of course, they're absolutely essential that we keep providing those. But as we've acknowledged repeatedly, if more than half the world's refugees aren't now living in refugee camps, how do we get them the same level of services, the same treatment? For the last couple of years, we've started work on this, particularly in Nairobi. Our main focus has been to work with small women's groups who are providing support both to refugees and to Kenyans, helping them, and we've been helping them to access medical care, to increase their access to education, to access financial grants, and to give them information about their rights, whether as Kenyans or specifically their rights as refugees. We've also just started another program which again will help both urban refugees and Kenyans, which focuses on reducing the exploitation of children who work in the informal sector. And of course, a lot of refugees work in the informal sector because they don't have the necessary paperwork to get access to legal employment. Unfortunately, like everybody else, we're finding it very challenging getting funding for work with urban refugees. A 3-year grant that we did have that was supporting our program with the women's groups was cut after 2 years when the donor decided as a policy decision that they no longer wanted to support work for urban refugees within that fund. That seems a really poorly timed and very unfortunate decision given the situation that we're talking about here. That was one of the reasons that we decided, this was a really important study to support, and that the more work that could be done on it and the more research that we could have into the specific problems of urban refugees, the better. As I've said, the level of funding and attention that goes to refugees is nowhere near the 50-50 split that you would find between sort of urban and camp situations of the numbers living there. The camps are absolutely essential, but they're very much a short-term measure. There weren't actually pictures of the camps in the film, but you all will have seen hundreds of pictures of refugee camps. They're temporary tents, often in very harsh locations. I mean, if you think of where the camps in Dadaab are, and similarly in other countries of the world, they're in very harsh environments. Often the refugees don't come from a rural setting. They may come from a capital city, they may come from Mogadishu, and suddenly they're in the middle of a desert, essentially living in a tent. They don't have a right to earn a proper salary. They can earn a sort of incentive from NGOs like us, but obviously add to that the insecurity of the camps. Like most of us probably, people choose to take their chances in the cities. And that's despite the fact that, as I think Samir said, it's made clear to them that they won't receive assistance in the same way as the cities. Nobody moves to Nairobi expecting that they're going to get a WFP handout or have access to a clinic in their local neighbourhood in the same way that they would in the camp. as the report describes, when they get there, there are huge challenges. You know, the lack of formal employment, the alienation, the harassment by the police, the lack of official papers, and for us trying to help them, we also face particular challenges when working with urban refugees. They're a lot more difficult to identify. Refugees in a camp, apart from the fact they're all in a camp, you know, there is a gate and you can register people as they come into the camp. They're much more difficult to identify in an urban setting. And often for very good reason, they don't want to be identified. You know, some of them have moved to Nairobi specifically so that they don't stand out. And once they are there because of the harassment, because of the other problems, they don't want to stand out as separate. They fear if they register that they're going to somehow be sent back to the camp or be sent back to their country of origin. So the normal mechanisms by which we would register them and be able to access them don't work in the same way in urban settings. They're also harder to assist. Again, they're not in one place. You know, you can't just plonk a clinic in the middle and be able to treat them all in the same way. They have very different needs. You know, what they need in many cases is legal protection, is addressing fundamental issues within the Kenyan police service or corruption within government bodies. Those are much harder issues to address than than providing services in a camp setting. All of which is made much more difficult, obviously, by lack of resources. You know, it's much harder work and there's much less money for it. In terms of the recommendations in the report, I think it makes some very, very good, clear recommendations, particularly the idea that we need a lot more research to understand the specific vulnerabilities of urban refugees. We also need to look at the specific vulnerabilities of the urban poor more generally. You know, this is one sort of subset within that group. But much, much more work needs to be done. And we also need to develop models to assist them, and this is where pilot studies are very, very important. IRC and others have started to look at things we can do. We have it's not quite a wish list, but we have a lot of work that we really would like to start doing in the near future. We'd like to increase our support to refugee information centres where refugees can come and access information about their rights, but also where we can build up knowledge of the trends, of the issues they're facing, you know, so that we can have interactions with them in a way that we might not otherwise do. Interventions that build social cohesion and trust and try to break down some of the social barriers to their integration. Some child and youth protection initiatives, particularly building on the programme that I talked about, trying to address the issues of sexual exploitation for children in the informal sector. Working with the police and judiciary on refugee rights and awareness. Rolling out, there is a police training manual and other materials that have been developed to deal with these issues. Now we need to work to actually roll that out to make sure that people are using it. Again, livelihood support, of course, is absolutely essential, and this is another area of work on. All this does need support. It needs financial support, but it also needs the will from other NGOs, from the UN, from national authorities, from donors, to really put the resources behind it and to cooperate to make it work. But all of this also needs to take place within a wider discussion about what really constitutes a durable solution in these protracted crises. Nobody wants to live in a refugee camp on handouts for 18 years. You wouldn't, even if the camp wasn't in the middle of the desert in the most harsh environment. That's a short-term solution, and these are long-term problems. So that's still a conversation that needs to be had.
Thank you very much.